Together we achieve victory over heart failure.
Welcome everyone. I am Dr. Avishek Bagchi, currently working as an intervention cardiologist in Notia Gateway Hospital, Siliguri. I'll be talking about some fact regarding heart failure today. There is a lot of misconception regarding heart failure and heart attack, and it's very important that we differentiate the truths from fiction, fact from fiction. So one of the important misconception is that heart failure occurs only in elderly. This is completely wrong. We have young patients with heart failure also. We have patients with some congenital disease. As for example, congenital heart diseases, the dilated cardiomyopathies, where the heart is weaker at an young age, can present with heart failure. Patients are having heart attack at young age and presenting with heart failure. So heart failure targets only the elderly people is a complete myth. We should not accept it. Second is that only chest pain means heart attack. This is also wrong. Sometimes we see that patient presents with very atypical kind of symptoms, which the patient don't think that it's heart attack, which actually turns out to be heart attack. As for example, pain in the abdomen, shortness of breath, feeling dizzy, nausea, this kind of atypical symptoms, pain in the hand, pain in the neck, they also can be classical signs of heart attack. Third is that all people normally believe that heart failure means that your heart has stopped. This is not the case. The heart failure means that there is water congestion in the lungs and the heart is not pumping properly, and it requires proper treatment, which can sort of improve the symptoms. And another myth is that a long-term smoker can lower the risk of heart disease by quitting smoking. Though patients who are long-term smokers have a certain risk of heart failure even after quitting, but the risk can be reduced after quitting to as much as 50% after a decade or so. And the final fact that I'm going to tell you that I shouldn't exercise after having a heart attack. This is a complete misconception. Patients after heart attack obviously requires to be in bed rest for the immediate period, say 7 to 14 days, and depending upon his or her response after the heart attack, the patient can come back to normal day-to-day activity and can start doing exercises. Obviously, there are certain exercises which patients with heart attack or weak heart avoid, but normal day-to-day activity, running, jogging, swimming, they can do. And in fact, they're better for them. So with proper care and treatment, individuals with heart failure can lead good lives, long life. Their quality of life can improve. And I hope that all this information will be helpful to you and you can propagate this information to others also. Thank you everyone for listening.